Assalamu alaikum and welcome to the sixth match of Cardiometabolic Premier League, the Battle of Brains, presented by PSIM and PHL, powered by Wilson's Pharmaceuticals. We are into the sixth match of Cardiometabolic overall, and this is the third match of Group B between PIMS victors and Allied Qalandars. And this match will decide the fate of this group, who is going to qualify for the Super 6 stage. From Group A, AIMS Invincibles have already been qualified for the Super 6 stage. Today, we are blessed with the kind presence of Professor Azizur Rahman Saab. He is Professor of Medicine, Senior Vice President, PSIM. Along with him, we have with us Dr. Saira Kanwal. She is coach of PIMS Victors and assistant professor of medicine at PIMS. Last but not the least, moderator of today's match is assistant professor Dr. 𝐏𝐈𝐌𝐒 Sahab. He is assistant professor at RIC Rawalpindi. He is interventional cardiologist and stroke interventionist. For further moderation, over to Dr. 𝐏𝐈𝐌𝐒 Sahab.
Bismillah ar-Rahman ar-Rahim. Thank you very much, Usman. So we are back with this outstanding season of Cardiometabolic Premier League. And we have seen some wonderful matches. As we all know, this league is brought to you by Wilson's Pharmaceutical. They've done a wonderful job to put it up. And definitely it's in collaboration with Pakistan Hypertension League and Pakistan Society of Internal Medicine. We all know all the league matches are knockout matches. So we have the sixth match which is going to decide the fate of Group B. And yes, anyone who wins with the highest score is going to get to the next stage, which is going to be an extremely important stage. So today, it's the clash of two good teams. We have PIMS Victors from Islamabad. That's their home turf, I believe. And we have 𝐏𝐈𝐈𝐒 Qalandars from Faisalabad. So these two teams will be up against each other, locking the horns. And let's see how it goes. And best of luck to both the teams. I would like to take this opportunity to welcome our esteemed council members. And as Usman has mentioned, to grace this wonderful game today, we have our umpire for today's game, and that's Professor Azizur Rahman Saab. So it's great to have you, sir. We also have the coach of PIMS Victors, which is Assistant Professor Dr. Saira Kanwal. And we are hoping to have more faculty and panel members. We'll have the introductions as they keep coming. All right, so the visibility looks good. The weather seems to be pretty good. The sun is shining bright. And I think the wicket, it's quite hard. I'm expecting a lot of bounce and at the same time, some seam movement. So before we do that, I think I'd like to get the attention towards the two teams, and I will request the two captains to introduce the teams. So randomly, I'm going to ask, is it PIMS Victors that we have on the screens, or is it 𝐏𝐈𝐈𝐒 Qalandars? Okay, 𝐏𝐈𝐈𝐒 Qalandars. Captain, have the introductions.
Assalamu alaikum. My name is Dr. Ahmed bin Tahir, along with the team competing for this league. On the left side, Dr. Ifra. Next to her is Dr. Fida, and near to me is Dr. Umair. On the right side, Dr. Fizan, including my team.
All right, so best of luck for the game today. Let's see how it goes. And can we have PIMS Victors? Captain, to introduce the team, please. But can we have them on the screen? All right, introductions, please.
This is Dr. Aima Khan, resident general medicine PIMS. Next to me is Dr. Bushra. Then we have Dr. Aisha, and then we have Dr. Fiza Shafi.
All right, so welcome to the game and best of luck to you as well. We are looking forward to a wonderful game today, and may the best team win. All right, so now moving towards the all-important toss, which is going to be electronically done. So can we have it on the screen? Yes. So randomly, I'm going to ask one of the teams as we have them on the screen. PIMS Victors, heads or tails?
Heads.
So heads it is. Roll the coin, please. And it's a heads. Well, it's a lucky start. All right, so I'm going to pose you with two questions as per the format. The first question is whether you want to throw the questions or you want to take the questions.
We would like to throw the questions.
Okay, so you want to throw the questions. Now the second question, you have two cases, two veneers, case A, case B. Which one do you pick?
Case A.
All right, case A. So I think we are done here. The news from the center is PIMS Victors, they have won the toss. They have elected to throw the cases and they have picked up case A. All right, so can we have case A, the veneer on the screen? And I will request the team, PIMS Victors, to read the question, please.
A 24 years old female was brought to emergency department with a 3-hour history of lightheadedness and palpitations. She experienced these symptoms while attending medical class. The patient has a 12-year history of bronchial asthma for which she was using salbutamol inhaler twice daily. She has had recurrent mild episodes of palpitations since joining medical college at the age of 19. Her mother is also a known asthmatic. On examination, the patient was afebrile with a pulse rate of 150 beats per minute, which was regular, a respiratory rate of 30 breaths per minute, blood pressure of 110/70, and oxygen saturation of 98 on room air. Precordial examination revealed tachycardia without any murmurs, and chest auscultation revealed mild bilateral wheezing. Cardiac enzymes were negative. A bedside ECG was done and is shown below.
एट्रियल फिब्रिलेशन है।
नहीं अभी रुके
मैं आपसे डिस्कस कर रही हूँ।
नहीं साइनस टैकी है।
देख लें टी वेव आ रही है।
सन चेक कर दिया रेगुलर इधर
लेकिन उसकी पैल्पिटेशंस और सिंकोपी की हिस्ट्री है, इसके अंदर कुछ होना है और
Hear me? Elite Kalandars, can you hear me?
Yes, yes.
Okay, so you can take a look at it. We'll give you a couple of seconds to gather yourself and then we'll start with the first question. So let me know when you're done.
ईसीजी दिखा दें।
Okay, revert the ECG. Put it back.
AFib नहीं
साइनस टैकी है।
ड्यूटी देखें। बॉन्स देखें।
Scenario.
एवीएल भी ठीक है।
सन चेक कर दिया
All right, teams. So I think now we are going to move to the first question. Can we have the first question, please? Pims, read the question, please.
Which of the following best describes this ECG?
Read the options as well. Pims, read the options, please.
Option A is accelerated idioventricular tachycardia. B is supraventricular tachycardia. C is atrial flutter with 2-to-1 conduction. Fifth is WPW syndrome. And E is pacemaker rhythm.
All right, so your timer starts now. 60 seconds on your screen.
देखिए एट्रियल फ्लटर में रिदम इरेगुलर हो जाता है ब्लॉक्स आते हैं वो नहीं है इडियोवेंट्रिकुलर में पीवी नीचे चली जाती है ठीक है सुप्रावेंट्रिकुलर में क्या होता है पीवी एब्सेंट हो जाती है ठीक है पेसमेकर का ये डी है
लेकिन क्यूआरएस कॉम्प्लेक्स प्रॉब्लम नहीं थे
ये नैरो थे ये नहीं
कार्डिया इसमें जो है
तो डी है
ये डी
डी
कर दूं
डब्ल्यूपी
डी है
डब्ल्यूपी
लेकिन वो शायद बीटा में ले रही है चेक कर दिया होता है क्या करना है
डी ऑप्शन पता नहीं बनता
बोल पार्किंसन वाई थोड़ा पे परसेंट भी ना सिंक भी है तो बोल पार्किंसन वाई
20 seconds.
डेल्टा पार्किंसन आएगा
ऑप्शन डी बोल पार्किंसन वाइट सिंड्रोम
Option D, are you sure? You want me to lock option D?
Yes, please.
Okay, D delta. They want us to lock option D delta. Lock it, please. Oh! So that high rising delivery, you've missed it. Oh goodness, the first one has been missed. Okay, with this, I would like to highlight a couple of things. Now, both the teams, please, never mind, you can miss a few questions, but then you will have your opportunities to score. Now, both the teams listen very carefully. Now, as per the rules of the game, there are two things I want to bring to your notice. First, you have to let the question finish along with all the options. Once they have read the options, only then the answering team is going to start discussions. Before that, nobody is allowed to talk. Please, I think in the spirit of the game, we have to follow the rules. And the other part, both the teams can have up to 4 players. You can't have the 5th player sitting with you. And I would request the technical side and the people, and I think the institutes as well, to ensure that only 4 players are playing in the game. So I think we have to follow this as per the rules of the council. All right. So, okay, can I have the teams on screen, please? Can I have the Kalandars? Okay, are the Kalandars there?
Yes, please.
Okay, Kalandars. So I hope you understand the point. 4 people to be sitting in front of the screen, and you only start discussing once they have read all the options. Before that, you can keep your mic mute as well. All right, so let's move to the next question, please. Question number 2 on your screen. Read it, Pims.
What is the first most important step in her management?
Read the options.
A is DC cardioversion, B is vagal maneuver, C is high flow oxygen, D is IV verapamil, E is nebulization with beta-2 agonist.
Now the timer starts, 60 seconds, and start the discussion, please.
Option B.
B, beta.
Yes, option beta.
Okay, you've come down the wicket, you want to heave it for a 6. Are you sure?
Yeah, sure.
Okay, then they are sure. Lock B, beta, vagal maneuver. Lock it. Yes! Very good. Well done. That was a 6 the moment you hit that one, and very well done. Over long off. Great start. That's the way to go. All right. Can we have the third question on the screen, please? Read it.
She does not improve with vagal maneuvers, including carotid massage and Valsalva. How will you treat her now? Option A, DC cardioversion, B, IV metoprolol, C, high flow oxygen, D, IV verapamil, fifth, nebulization with beta-2 agonist.
60 seconds on your screen.
Option D.
Option D, delta. Are you sure? Captain,
Yes, sure.
are you sure
Yeah,
it's
sure.
a 6?
Pretty much sure.
He has hooked this one. Option D, delta. Lock it. Oh, yes. Is that a freebie? Well played. I think still he had to play it well, smartly. Has it been played and it's gone over the square leg boundary for a 6. Well done, well done. So I see some good runs coming. Okay, we are moving to question number 4 on your screen.
She expressed concern about ventricular tachycardia. All of the following are features of VT except capture or fusion beats A, B, atrioventricular dissociation, C, extreme left axis deviation, D, response to vagal maneuver, E, broad QRS complexes.
Your timer starts now.
Option D.
Again, he has come down the wicket. He has taken it on a full toss. Is it going for a 6 or is it going to be caught? Option D, delta. Very well done. Very well done. So that is 3 in a row, 3 6s. Well done. I think Qalandars are on a roll at the moment. Who's going to stop them? Okay. Question number 5 on your screen.
Your junior colleague asks about treatment of choice if a relatively older patient with SVT presented with chest pain, shortness of breath, hypoxia, and hypotension. How would it be? A, IV verapamil, B, IV flecainide, C, IV amiodarone, D, synchronized electrocardioversion, E, unsynchronized cardioversion.
And the timer starts now.
Option D.
Option D.
You really like option D, isn't it? Again, he has come down the wicket. He seems to be the Jai Surya of the game at the moment. Option D. You want me to lock option D then? Should I lock it?
Yes, pretty sure.
Yes, lock option D, delta. And yes, he's right. He knows where he's playing. He knows what he's playing for. And that's another 6. Very, very well done. Well played. So again, I would like to reiterate, Elite Qalandars, you're playing wonderfully well. But still there is a lot of crosstalk before the question finishes. All right, so you only start discussing it once the question is over. I'll again request you to stay quiet, or you can keep yourselves on mute and then you can unmute yourselves. Thank you very much, Qalandars. Moving to question number 6 on your screen.
The classification of antiarrhythmic drugs is most commonly described using the Vaughan-Williams classification. This system categorizes drugs based on their primary electrophysiological effect on cardiac action potentials. Which of the following drugs is not part of this classification? A. Amiodarone, B. Lidocaine, C. Metoprolol, 5. Verapamil, E is adrenaline?
Adenosine. All right, timer starts now, 60 seconds. So let's see whether he plays like Jay Surya or is he going to play like Michael Vaughan, just like Vaughan Williams here.
Option E, adenosine.
Again, Jay Surya. Option E. You want me to lock it?
Yes.
E epsilon. You know, Isak. All right, the technical team is also on a rampage today. They really are in a hurry. Well done. So we have E epsilon, another 6. Well done. So it's 5 in a row. I knew it was a bouncy track and I was expecting for a big score. And here we are. Okay. Question number 7 on your screen.
She asked about other uses of adenosine. It is effective in all of the following conditions except A. SVT, B. Atrial fibrillation, C. Atrial tachycardia, D. Atrial flutter, E. Ventricular tachycardia.
Timer starts now. And I've just been told that we are joined by Professor Dr. Lubna Miraj. He's the Associate Professor working at Rawalpindi Medical University. Welcome, ma'am. Great to have you.
Option E.
VT हो जाएगा.
ब्लॉक कर देगा.
हाँ ब्लॉक कर दे. VT हो जाएगा.
Option E.
Option E. Okay, now just hold on. Are you sure about it?
Yes.
I see the ball moving away from you. Is it going to take the edge of the bat? Let's see. Lock E epsilon. Oh, no. You've done it very well. That's an uppercut for a 6. Well done over third man. Very well played. So I think, well, it's like a roller coaster for them. Almost there. 7 questions already gone, and they have answered 6 of them correctly. Only 1 miss. Can we have question number 8 on the screen?
What is the exact dose of IV adenosine? It's 1.6. 1.6.
No, it's 1 to 6 milligram. 1 to 6
1 to
milligram.
6.
Option B, okay.
You can
Okay, I'll take it from here. Option A, 1 to 6 milligram. Option B, 3 to 6 milligrams. Option C, 3 to 9 milligrams. Option D, 3 to 12 milligrams. Option E, 6 to 12 milligrams. 60 seconds, start now.
पहली 6 होती है, दूसरी 12, तीसरी 18 होती है. पहली 6 है.
1 to 6.
1 नहीं देते भाई. देनी 6 है जी.
6 to 12. हाँ 6 to 12. 6 to 12.
Option E.
E epsilon. Are you sure?
Yes.
You want me to lock this one?
Yes.
This seems to be coming into the pads. Let's see whether it's an LBW or this one is going over square leg. Lock option E, please. Oh, and it's on the pads. LBW it is. Leg before wicket. Oh my goodness. So that's, again, I think that's still great going because that's your second miss. All right. So with this, now we have 2 more questions to go in this innings. Question number 9 on your screen.
Regarding the adverse effect of adenosine, all of the following are true except tachycardia, B. flushing, C. chest pain, D. bronchospasm, E. headache.
Timer starts now.
टैकी नहीं होगा ना. ब्लॉक कर देगी ना. हाँ.
नीचे चारों होते हैं.
स्पिरिट ए बी है ना.
ए तो होता है, हेडेक तो होती है बस.
ए होता है.
ए कर लो.
या ब्रोंकोस्पैज्म इसमें होता है एडिनोसिन में एजमेटिक.
नहीं डी तो कंसीडरेशन ही नहीं है ना. बी भी ठीक है, डी भी ठीक है, ई भी ठीक है, ए और सी है. चेस्ट पेन टैकीकार्डिया. अब वो वेंट्रिकुलर टैकीकार्डिया करता है, वो टैकीकार्डिया सिंपल उन्होंने लिखा हुआ है.
Is this a dusra from the spinner? All right, let's see. 25 seconds, come on.
ए.
Option A, tachycardia.
Are you sure about it? You still have 18 seconds.
Yes, I am pretty sure.
He's pretty sure. The captain is leading from the front. Lock A alpha. Oh, yes, and he's sure. He knows it. Very well done. This one has been hit for a massive 6. Very well played. We are really enjoying the discussion that is going on amongst the team members. So very well played. Well done. Now coming to the last question of this innings. I think this is an extremely important question because this may take you in that scoring range. Best of luck to both the teams. Question number 10 on your screen.
If she were not an asthmatic, which of the following would not be an ideal treatment option for SVT? A. Adenosine, B. Metoprolol, C. Digoxin, D. Diltiazem, E. Verapamil.
Timer starts now.
If she were not an asthmatic,
an asthmatic, which of the following would not be an area?
हाँ,
यानी not
फिर-
adenosine होगा,
हाँ।
adenosine आप देते हो,
Beta-blocker
भी
दे
देते हो,
सकते हैं, calcium-
diltiazem और verapamil दोनों हो सकते हैं, digoxin atrial fibrillation heart failure में देते हैं, वो बोलस में नहीं दे सकते हो, infusion में चलना हो सकता है,
विरापामिल
वही आ जाता है।
विरापामिल आ जाता है।
दे सकते
नहीं,
हैं।
verapamil तो देते हैं, वो तो मतलब
digoxin,
हो जाती है,
हाँ,
digoxin answer है,
digoxin।
चार नहीं
का नाम है सर, बड़ी
सी
इंपॉर्टेंट
थी
है।
डाइगोक्सिन
Digoxin.
डाइगोक्सिन
ऑप्शन सी।
नहीं, हम तो
So you want me to lock which one?
ऑप्शन सी।
सी
C, Charlie. You want me to lock it? Should I lock it?
यस,
Are you sure it's going to be a 6?
इंशाल्लाह।
So they've hit that one straight up. Lock option C. And yes, it's over. Over the rope for a 6. Very well played. Well done. Great going. A wonderful performance by the team. And I think allied Qalandars have put up a good show here. And that's a wonderful total that we've got. They only got 2 questions wrong and 8 of them were correctly answered. Well done. This leads to a total of 48. So that's a good total. Now let's see how the PIMS victors respond. And with this, we now come to the midway point. And I think I'd like to take our worthy panel members on board. Their opinions are extremely important. So we start with the umpire of the game, Professor Azizur Rahman Saab. Sir, your thoughts?
Thank you very much. I think the team played very well. They missed very first question, the very crucial one. And in fact, this time I added some images. And I think they need to improve their skills to read images also. And if you show me the ECG, I'd like to explain a few points to them.
All right. Can we have the ECG, please, on the screen? Bring the ECG on the screen.
And first, I think the case history.
Case history also. Before that, case history.
I think still had 3 hours of light eyes. I think it was probably not mentioned here. It was sudden in onset. And SVTs, typically, they start suddenly as compared to sinus tachycardias, which start gradually. And the rate could be similar. SVTs are typically 150 plus, whereas sinus tachycardias are typically less than 150. But let's see the ECG now.
ECG, please, on the screen.
And team made the diagnosis of Wolff-Parkinson-White syndrome. By the way, in patient with Wolff-Parkinson-White syndrome, when they develop tachycardia, the typical abnormalities they disappear, and I don't see any of those abnormalities. And there is no way to figure out that this patient had Wolff-Parkinson-White syndrome in the background. You can't actually guess. Only if you have the history and the previous ECG available, only then you can make a diagnosis of Wolff-Parkinson syndrome. So it is typical SVT. The only true differential diagnosis is sinus tachycardia if you just study the ECG. And this ECG is very regular. They were whispering about atrial fibrillation also, and rhythm is absolutely regular. There is no suspicion of atrial fibrillation, and you can see a definite P wave preceding all QRS complex with fixed PR interval. So it is typical supraventricular tachycardia. The only differential would be sinus tachycardia. In very fast rate, you actually don't see P wave in SVT because P wave is merged in QRS complex. But in some cases, if the ectopic focus is just close to SA node, the rhythm could be very much like sinus tachycardia. So from ECG, you sometimes find it difficult. From the rate and from the history, you figure out that this is actually SVT not just the sinus tachycardia.
Thank you very much, sir. I think extremely important points. And your thoughts on the score so far? What do you think? How they have done?
They've done very well. I think I was surprised after missing the diagnosis. They did very well, actually. They were very well versed on the theoretical part of the scenario. I think that is why I think images should be included, because that is another skill. You can apply your theoretical knowledge only when you are able to make a diagnosis first.
Very right, sir. I think absolutely agree with you. That's why we need to have the images, and it could be an ECG. Even the clips at times can help. And I think this league is evolving with all this. Some very important points coming from Professor Aziz Rahman Saab. I think the ECG is important, but at the same time, it's the history and the key points there, the sudden onset, all those things were pointing in a certain direction. And this is what we actually wanted to hear. And at the same time, when you look at the ECG, it is the regularity along with the waves, the P waves and the R waves. In cardiology, we always teach them how to march the R waves and the P waves. So I think it was pretty much there. But then, as we all know, the eyes will only see what the mind knows. So this is how it goes. Thank you very much, sir. What a wonderful input. And I think I've just been told that to grace the occasion, we have our Patron-in-Chief, Professor Javed Akram Saab, has joined us. So, sir, it's great to have you. Are you there?
Yes, thank you so much, and pleasure and honor. Thank you so much. Yes, Aziz Saab described the things very well, and as he always does, makes things simple, and enjoyed his explanation and learning a lot. Thank you.
Thank you very much, sir. Thank you very much, sir, for your thoughts. It's always great to have you on the show. You instill a lot of excitement in the game, and it's always great to have such stalwarts with us. And we are also joined by Professor Kashif Hashmi Saab. Sir, are you there? Your thoughts?
अस्सलाम वालेकुम जी। बस मैं अभी ज्वाइन किया है।
So the team has scored 48, and it was a case where we had SVT and they had to pick things. So they've put up a good total, 48. What do you think?
Comparative total. Have a good fight, inshallah.
Very right, sir. So I think it's always competitive once you've scored, but then the team has to chase that and do well. And it's an important game because this is going to be deciding the fate of this pool, Pool B that is. And we have Associate Professor Dr. Lubna Mehraj with us. Ma'am, are you there?
Yes.
Your thoughts, ma'am? It's great to have you.
Going very beautifully. The people played, and well done. Who are going to achieve good marks, and that is very good activity by Wilson. Keep it up.
Thank you very much, ma'am. It's always important to have encouragement coming from the faculty members. We also have Assistant Professor Dr. Saira Kamal. Ma'am, are you there? You are the coach also, so your team needs your support. Is she there? You'll have to unmute, and if we could have a word from you.
Yes.
Okay, so I think there was some distortion there. With this, now I think we'll move to start the second phase of the game, and that's the second innings. Okay, so do I have the permission to start the second half of the game, sir?
Please, go ahead.
All right, so can we have the teams back again?
SCVT में वैसे
I'll request everyone to keep their mics on mute, please, because the second half is going to start. So order in the house, and we are all ready for the game. All right, can we have the scenario on the screen? Read the scenario, please.
A 62-year-old man presented to the emergency department with the chief complaint of severe tearing chest pain localized to the interscapular region, which began 30 minutes prior to arrival. He has a 12-year history of uncontrolled hypertension, for which he has been using homeopathic medications. He is a smoker with a six-pack year history. Eight. According to his attendants, he experienced intermittent episodes of headache and blurring of vision in the past. On examination, the patient appeared to be an elderly male of average build and height. His blood pressure was 180 by 100 millimeter mercury. Pulse rate was 110 per minute and regular, with no radiofemoral delay. Respiratory rate was 30 per minute and oxygen saturation was 96% on room air. His blood sugar random was 130 milligram per deciliter and jugular venous pressure was not raised. He was conscious and oriented, with no sensory or motor deficits. Precordial chest and abdominal examinations were unremarkable, and distal pulses were intact. Fundus examination revealed bilateral cotton wool spots with no papilledema. And electrocardiogram showed sinus tachycardia with evidence of left ventricular hypertrophy. Echocardiography revealed a left ventricular ejection fraction of 55%. Cardiac biomarkers, including CK-MP and troponin I, were slightly elevated. Routine investigations, including
complete blood count.
Can you read it?
Complete.
Okay.
Yes,
please continue.
Including complete blood count, renal function tests, liver function tests, serum electrolytes, and arterial blood gases were within normal limits. XS chest is shown below.
All right, the image is there.
ये तो डायग्नोज ही बता देना.
So PIMS Victors, you have a couple of seconds to gather yourself. Let us know when you're ready and we will start with the questions.
Here में बचते.
And I'll request everyone else to keep your mics on mute, please. That creates unnecessary distortion. All right, so let's just move to the first question now. Can we have the first question on the screen, please? Question number 1. Read it, please.
Which of the following best describes this XH chest? Alpha, tension pneumothorax. B, mediastinal widening. C, massive cardiomegaly. D, lobar pneumonia. E, pleural effusion.
And the timer starts now, 60 seconds.
It's B, mediastinal widening.
Okay, they've come down the wicket. All right, so is this Adam Gilchrist or what? B, mediastinal widening. You want me to lock it? Are you sure?
Yes.
Are you sure? Because I've just been told Professor Ishaq, our patron-in-chief, he has also joined us. Welcome, sir. It's great to have you have you on the show.
Thank you, sir. Thank you, Hamza.
And he would not be happy, but then B, beta. Fine. You want me to lock it?
Yes.
All right. Lock B, beta. Very well done. And that's a 6. The Adam Gilchrist in you has slammed it for a 6 over long on. Beautiful start. Wonderful. Ishaq Saab is there, and he always guides everyone to take your time and make the most of it. But today, both the teams are thrashing things around and in a quick succession. Very well done. Very well played. You've got a big total, but you can do it.
Question number... As I joined, you had the first 6er.
Sir, it's always great to have you, and we have 6s galore today. Well done, teams, and well done, sir. Question number 2 on your screen.
What is the most specific investigation to confirm the suspected diagnosis? Option A, CT aortography without contrast, MR angiography without contrast, CT aortography with contrast, transesophageal echo, and HRCT.
All right, timer, 60 seconds on your screen.
It is C, CT angiography with contrast.
Okay, are you sure?
Yes, we are sure.
The girls are too fast.
Sir, they are on a rampage at the moment. I think they are trying to kill them in time also. Very good. So again, it's C, Charlie. You want me to lock it?
Yes.
Okay, lock C, Charlie. And wonderfully played again. That is beautifully smashed for a 6. This time over square leg. So they are on fire. I think they really want to chase it down as soon as possible. Well done. Well played. All right. 2 questions, 2 6s. Question number 3 in front of you now.
For management purpose, what are the treatment goals in this scenario? Systolic blood pressure control to 120 millimeter of mercury within 30 minutes. B. Pulse rate control to 60 per minute within 30 minutes. Option C, A and B. Option D, BP control by 20% in 2 hours. And option E, BP control to 160 by 100 millimeter of mercury in 2 hours.
60 seconds on your screen. So that one is moving away from them. Let's see how they deal with it.
It is option C, both A and B.
Are you sure about it? C, Charlie.
Yes, we are sure.
They are sure and they want me to lock it. Should I lock it? You still have 30 seconds. Okay, so your mics have to be switched on. The answering team, we want to hear the discussion going on. Keep it switched on, please. Come on, 15 seconds. Hurry up now.
It is
12. C, Charlie.
C.
Okay, lock C, Charlie. Yes! Very well played. That's a hat trick for you. Hat trick of 6s. And this one is over covers for a 6. Beautifully played. We want to hear the discussion that goes on, and you are doing very well. And I know Qalandars are now a bit worried. They want to throw in the quicker ones, the ones which beat you. Let's see how it goes. The game is on. Question number 4 on your screen.
What is the best antihypertensive agent to control his blood pressure? Option A, labetalol. Option B, nifedipine. Option C, enalapril. Enalaprilat. Option D, furosemide. And option E, nitocloside.
And the timer is on your screen.
Beta blocker, esmolol or labetalol. It's A, labetalol.
Are you sure? Again coming down the wicket, and is this going to be a ramp shot this time? A. You want me to lock it? A alpha.
Yes.
All right, they want us to lock A alpha. Lock it. Oh yes, the girl power is on a roll. What brilliant answering. They're getting everything right. That's another 6. Sir, they are playing it very well, and I think they are aiming for the higher fruit. They know it's consequential. They have to top it. They have to top the pool in order to get into the second stage of this tournament. And very well done, very well played indeed. Question number 5 is on your screen now.
All of the following drugs can be used in this disease except nebivolol, option B, nifedipine, option C, esmolol, option D, nitocloside, and options E, hydralazine.
60 seconds on your screen.
नाइट्रोप्रोसाइड भी यूज होता है नाइट्रोप्रोसाइड भी यूज होता है ठीक है एस्मोलॉल भी यूज होता है सीसीबीज भी यूज होता है सो इट्स जस्ट हाइड्रोसिलिसिन लेफ्ट
So they've brought the spinner to slow things down. Let's see where it's turning.
Hydralazine. E. It's E. Epsilon. Hydralazine.
Oh, you're sure about it? You want me to lock it?
Yes.
Okay, the captain says yes. There is a lot of assurance in her voice. With this, we will lock E epsilon. Oh, that's the... But I think no, it's the right one, I think. It's the right one, yes.
Yes, we
That's
said hydralazine.
yes, that's the correct answer.
You're
That's
right.
the correct answer. All right, you said yes. So you said it was a technical mistake and you got this one right too. So that leaves us with 6 correctly answered questions, 2 hat tricks in a row. Very, very well done. Just 4 more questions to go. You can still wrongly answer one, you will make it through. 2 wrong answers, you'll draw. You correct them all, you answer them all correctly. Oh yes, you're going into the next stage. Let's see how it goes. So every question is important. You have to play it carefully now. You've put yourselves in a wonderful place. Can we have the next question on the screen, please? Read the question, please.
Where will you classify him in hypertensive retinopathy grades based on his fundus examination? Option A, grade 1, option B, grade 2, option C, grade 3, and option D, grade 4, and option E, grade 5.
Start the timer.
It's C option. It is option C, grade 3.
All right, they've taken a few steps down the wicket again. They've gone for the glory. Are you sure it's C? Charlie? Are you sure?
Yes, we're sure.
C, Charlie. Let's see. Lock C, Charlie. This one is going up. And it's over the boundary. Very, very well played. 6 runs again. And now we have achieved the hat trick. Very well done, that we were waiting for. Very good. The scenario has been explained already. You have everything to play for. Let's see where we end up. Can we have the next question? Question number 7. Read it, please.
If the same patient presented with the BP of 2210 by 110 millimeter of mercury, diminished pulses in the lower extremities and radiofemoral delay, what would be the most important treatment? Option A, high dose of labetalol infusion. Option B, urgent surgical repair. Option C, combination of esmolol and lividipine. Option D, combination of esmolol and nifedipine. And option E, combination of esmolol and nitroprusside.
And the timer starts now.
Combination of esmolol and nitroprusside नहीं बनता. Labetalol confusion नहीं BP नहीं आना. The first line is esmolol. First line is esmolol. अमर से labetalol लिखा. लिखा मैंने तो आपको esmolol लिखा. अभी किसी का भी esmolol है क्या and nitroprusside for.
Is this a dusra? He's keeping a tight line, the spinner.
Not working.
30 seconds. 20 seconds, come on. Which one?
E. It's combination of esmolol and nitroprusside.
Okay, E epsilon. So they want us to lock E. Lock option E, please. Oh, and this time it's the first mistake of the innings. All right. The ball turned quickly and we knew this was going to behave like a dusra, and it has. Okay, they've gotten this one wrong. The first miss of this innings. Never mind. You're still in the hunt. There is still a lot to play for. You have 3 more questions. Play it wisely. Question number 8 on your screen.
All of the following statements are true about this disease except option A, it may occur in the absence of hypertension. Option B, bicuspid aortic valve is associated with increased risk. Option C, patients may present with mesenteric ischemia. Option D, anterior wall abnormalities are more prominent. Option E, ECG may be normal in some patients.
And the timer starts now. 60 seconds on your screen.
Hypertension mesenteric ischemia भी होता है. ECG नॉर्मल में मिल सकते हैं. ECG नॉर्मल में अगर
anterior wall. D, no? D option, anterior wall abnormalities are more prominent.
Are you sure you want me to lock D delta? Should I lock it?
Yes.
Yes.
Is it a yes?
Yeah.
Yes, yes.
Okay, they are saying yes, yes. They want me to lock D delta. Let's see. And yes, you're right. Yes, yes, you've done well. And this one has been heaved over long on, and it's a beautiful stroke. So that was very well played. I could see a little stutter there, but I think you got it right in the end. Well done, very well done. So this is getting interesting now. Last two questions. They get it right, they are through. They get it wrong, well, then it's going to be a different story. So 2 questions all to play for. Best of luck to both the teams. Question number 9 is on your screen now.
What is the most common precordial examination finding if the disease is complicated and presents as valvular heart disease? Option A, mid-diastolic murmur at the mitral area. Option B, paradoxical splitting of second heart sound at aortic area. Option C, systolic murmur at the aortic area increased with increased preload. Option D, systolic murmur at the aortic area increased with the decreased preload. Option E, early diastolic murmur at the aortic area.
And the timer starts now, 60 seconds.
AR का मरमर आएगा साथ early diastolic E तो E आएगा E है bicuspid aortic का ज़्यादा aortic stenosis का necessity bicuspid नहीं aortic regurg का patient ये तो regurg का है ना अगर यही मसला जो है E है ना E it's E early diastolic murmur of at the aortic area.
E epsilon. You are sure about it? Should I lock it?
Girls, take your time. Take your time.
Listen to Ishaq Saab. Yes. Listen to Professor Ishaq, please. You have 16 seconds.
This is complicated and presented as valvular heart disease.
10 seconds. Come on. 8, 7, 6. Come on. Answer. Answer. Okay, and E epsilon, we have to now lock it. We are out of time. Lock E. And yes, you were right. Your instincts were correct. Very well played. This was a tricky one, and you got this one right. So this is how I think this is the teamwork that comes into play, and your first instinct is mostly the right instinct. That's what we have all learnt over the years, and I think the masters are going to give their views on that, and we'll definitely ask them once we are done with this last question of this innings and the match. So if you get that right, we now have 2 teams at 48 apiece. This last question is going to be the decider. I think this is again happening in the last match. We had the same situation. We went to the wire. We went to the last question. And this is the deciding question. Can we have question number 10 on the screen?
If the dissection had extended to the right coronary artery with marked elevation in troponins, what would be the expected EC changes? ST elevations in lead 2, 3 AVF. Option B, ST elevations in leads V3 and V4. Option C, peak T waves in lead 1, AVL and V4 and V6. Option D, diffuse ST elevation in all chest leads. And option E, tall R waves and ST depression in leads V1 and V1 to V4.
And the timer starts now, 60 seconds. Very crucial. 60 seconds.
It's A, ST elevation in lead 2, 3 and AVF.
Are you sure about A, alpha?
Yes, we are sure.
So you want to play this last extremely important question like Shahid Afridi? You want me to lock it?
Yes. Yes, yes.
Okay, yes, they are sure. Well, lock A, alpha. Yes! And that's it. They got it on the full toss.
Oh my goodness. Oh my goodness.
No. I have 2 reservations to make before you announce the result, please.
All right, sir. All right. So the umpire is there. Sir, please go ahead.
Number 1, I think I sent the questions, this image without the label. I would like to know who put the label on that X-ray of dissection. Usman, who did this, who put the label on this X-ray? This makes it unfair because the first team got ECG. They were to interpret it. The second team was also to interpret themselves. Who put the label on this X-ray? I would like to know.
Right, sir. I think I'll ask the technical team to answer it. So can we have somebody from the technical side to answer the query posed by the umpire?
Usman, I think Usman is the best person because he is the one who is handling this.
Usman, please, can we have you?
Okay, I think as an umpire, my decision is I would like to give the benefit to the first team, and the first team's first question should be considered correct because they missed it. The second got picked up because it was labeled.
Yes, I think, sir, in all fairness, that's why we have the umpires there, and it's great to have umpires like you. And I think we do have the technical side. Is Usman there?
And I'd like to comment.
Ji sir, I am here. Basically, the picture that was sent by Professor Azizur Rahman Sahab was without label, actually. While incorporating in our system, we made it crop it, but unfortunately, this couldn't be make like as it was sent by Professor Azizur Rahman Sahab. It was initially and originally without label.
So that was, I finalized the paper. So it was unfair to change it after my finalization.
Sir, basically, our technical team, when they tried to incorporate in our system, question answer system.
I cropped the image without the label. I think
yes.
Either you nullify this question, null and void. And to be more fair, the first team should get the first question considered correct. And now I also like to comment on question number 5.
Okay, so can we have question number 5, please? The umpire wants to take a look at that also. Question 5 of the second innings, sir, or the first innings?
Second inning.
Second innings, please. Question 5. Please display it.
ये हमारा ठीक है ये ठीक था हमारा इन्होंने गलती की हाँ हमारा भी है
अच्छा ये देखें all of the following drugs can be used in this disease except इसमें an answer is hydralazine because hydralazine can cause tachycardia and tachycardia is something we don't want in patients with dissection of aorta. In fact, we want to bring down their blood pressure as well as their heart rate. Hydralazine can cause reflex tachycardia. So the correct answer in this was hydralazine.
Yes, sir. I think that was corrected on the spot because even that was quite visible, and the technical side immediately they responded and they told us that that was wrongly labeled, and the correct answer was hydralazine, and this was given to the team. So, but I totally agree with you that.
About first question, you can ask the opinion of Professor Javed Akram how to handle. Should we?
Yes.
Should we ask both teams one more question, or should we give the first team one question correct?
That's wonderful, sir.
Thank you so much, Aziz. Thank you so much for bringing out this. I totally agree with you. But I also have a slight objection. Obviously, I am biased because I was the first Vice Chancellor of PIMS. So they are probably my students or grand students, I don't know. And they did very well. I think the question of coarctation of aorta, nobody, I think, will dare to operate at 220 over 120. You will obviously settle that blood pressure with esmolol or whatever they said, and then operate. There is a need for urgent correction, there is no doubt. But I think the first treatment would be to, nobody will put that patient to sleep even at that blood pressure. So I think that answer that they scored wrong will also be reviewed by the
judges. That question is referenced, I think, with that pressure, with ischemia of the limbs, I think it is referenced that urgent repair is needed.
Yeah, but after stabilizing the blood pressure, no anesthetist will put him to sleep. it will be, the question should be after stabilization. And stabilization probably when that patient lands up, yeah, to work out, to put him to such a major surgery, you'll have to admit him and give the first treatment with drugs. And then obviously as soon as possible, the anesthetist agrees and the surgeon agrees, they
Well,
should be
sir,
corrected.
I respect your opinion, but that the answer is referenced. I think you can check the reference given on the question.
Yes, I agree with Professor Azizur Rahman. Clinically, you may be correct, but I think with reference, we have to follow the question as per reference. Now, regarding this discrepancy that raised by Professor Aziz, I agree with him that we should give one more question to each team and to make it fair assessment. So I think both the teams should have one more question to go.
Right, sir. So
we have,
sir.
Sir, we have a query from question number 8 from our sides.
Okay, please go ahead. What's the query? We have the umpire, Professor Aziz. He's there to guide us. Yes.
Please view the question number 8. The answer should be the 6 to 12 mg of adenosine dose, not 3
Can
to
we
12.
see the question?
Can we have the question, please, Council? All right. Yes. The question is there, sir. So they have a query regarding the dose and the right answer.
I think this question is slightly tricky because I think when you give different options, they should not be overlap. But this was also reference. The question D is been given correctly by the reference.
But sir, we administrator at the clinical levels, minimum dose is 6, 10, 12, 10, 18 mg.
There are bound to be some questions with some overlap figures, but I think as long as there's a reference to support, we have to just follow. This has been the practice in all the matches in the past as well. So I think Professor Aziz has ruled that we should just follow the reference.
Okay.
This is all about the competition, as you see.
Yes, sir. I think thank you very much for the input. I think we have the faculty members and the umpires, and they have given the verdict. So there are always overlaps. I totally agree. But again, you see, when you have the references which the team has at the moment and they've been reviewed thoroughly, so you have to pick the right answer which is backed up by the references. So with this, we now move to the last stint. So I can think of a super over that is going to be done here. And I'm glad that the umpires and the council members, they stepped in and they have given the decision. So what we'll have now is we are going to throw one question apiece to both the sides. And then we'll hopefully decide as to who is going to take this match and move forward. So can we have the two sides, and we are going to randomly decide one of the teams, and I think in the continuity that Allied was following, I think Allied is going to answer and we will bring the first question on. So can we have Allied on the screen? Allied Qalandars, are they there?
Hamza, do you have a question in the bank? Or Professor Aziz Rahman has got something?
Sir.
We have the next question in line. Which
yes, sir, we do have the questions lined up. Yes, we always have space for super over and something which make it even more exciting. So definitely we have it. And I think, Allied, are you ready for the question?
Yes.
Okay, and PIMS Victors, you'll have to read the next question. Are you ready?
Yes.
Okay, read. Can we have the question? Read it, please.
Regarding paroxysmal supraventricular tachycardia and its treatment, all of the following are true except number first is, can you read the options, please?
Option A is etripamil is a short-acting calcium channel blocker. SVT, option B is SVT typically has gradual onset and offset. Option C, often responsive to vagal maneuvers. Option D, verapamil is a long-acting calcium channel blocker. Option E, half-life of adenosine is less than 10 seconds, 60 seconds on your screen now.
Option B.
Option B, beta. Are you sure?
Yes.
So Jayasuriya is at it again. Where is it going? For a 6 or is it going to be caught? He thinks it's a 6. Definitely over long on. He has given it everything he's got. So I'm going to lock option B, beta. Yes! That is very well done. You got this right. And now you've put pressure on the other team. Now they have to answer correctly. Can we have the next question on the screen,
We may be
please?
heading for another draw.
We could be, sir. We could be. I hope we've got more questions. Let's see. All right. Next question, please. On the screen. Read it, please, Elite Kalandars.
All are possible causes of differential blood pressure in different limbs except patent ductus arteriosus, option B, Takayasu arteritis, option C, coarctation of aorta, option D, subclavian steal syndrome, and option E, aortic dissection.
60 seconds on your screen. We are all on the edge of the seats.
A? It's option A.
Are you sure?
Yes.
Afridi is at it. She wants us to lock A alpha. I'm going to lock it. Should I?
Yes.
Lock A alpha. And yes! That's a 6 again. So we have another draw.
Aziz Saab, nikale question aur.
Okay, we have one more question for each. Otherwise, I'm going to ask a question each team to make a
Wonderful, sir. Wonderful. So
we can go for toss at the end.
we still have one set apiece, sir. I think this is going to be question 12 for both the sides. So can we? All right. So there's some technical glitch here, and I've been told they need at least 8 to 10 minutes to get the questions ready. So, sir, do you want to have your wishes coming true, Aziz Saab? Sir.
You want me to ask a question?
So, yes, if it's possible, whatever the council decides, or I think we can wait for the next 5-10 minutes for the question.
I think we should wait.
Okay. So the umpire says, get the questions on. Bring them on. All right. In the meantime, I think we have the faculty here. How is it going, sir? Aziz Saab, what do you feel?
I'm very much excited. I think match is doing very well. That you are doing very well. Your best performance as always. I think both the teams are doing very well. I'm really enjoying. I'm really into it.
Thank you very much, sir. I think as luck would have it, they keep me on my toes. Every day is a new day. And that's what I was telling Kurban when he wanted to start. I told him, you can always have anything. You should be ready for anything at the spot. And
you're doing so well. I often wonder, are you a real person or a IEA generated Superman?
So that's an interesting, I would say, comment. And I think I'll be over the moon. But thank you very much. I always get transported right from the cath lab, so it's quite interesting and a diverse thing for me from that interventional work. Here I am, this wonderful academic activity going on with such masters. I think it's a privilege for me, and we all learn so much no matter what we do. It's learning for everyone, and we do have Professor Javed Akram Saab. Sir, how do you feel? I know you're on the move, but you're still there.
Yeah, Hamza, I am not on the move. I am fortunately with two legends of cardiology, Professor Bilal Zikriya Khan and Professor Solis Siddiq in the spectators. And they were clapping. They were clapping more at Hamza than the teams. But anyhow, it's good. They are here and they say hi to them and thank you to them for raising their voices. Bilal Sahab.
Sir, Assalamu alaikum, sir. Bilal Sahab, Assalamu alaikum, sir. Kaise hain? It's great to have you. It's been a while.
Thank you so much. हाँ जी 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 बिल्कुल आप कैसे हैं
अल्लाह का शुक्र सर ठीक ठाक सो अल्हम्दुलिल्लाह सर
ये रेयर कमोडिटी कहाँ से आ गई है
जी जी
हाँ जी ये अब शौल साहब से भी बात कर लें
Ji, Assalamu alaikum ji.
Assalamu alaikum, sir. Great to have you on the show. You've been like mentors to so many of us. MashaAllah, sir. Great to see you.
Acha ji. Thank you, and you're doing a good job.
Thank you,
Nice
sir.
work. And I hope you have more success in it, and all the level
Inshallah,
of the
sir.
knowledge increases with these programs.
Inshallah, sir. Thank you. So
Thank you
great
so
to
much.
see. It's a privilege, sir. Thank you. Thank you very much.
Thank you, Amta, for conducting it once again. It's always a pleasure.
Thank you, sir. The pleasure is all mine. I think
think
you
both
are
are
the true stars.
very well.
Thank you, sir. It's a galaxy of stars that we have today. I think I'm so excited to be amidst all of you. And the
Yeah,
game.
one galaxy is with you on the line, Ishaq Saab, and also Aziz Saab, and so many judges. And I think we are, the pollution is gone, and all the galaxies very visible now. So thank you so much to everybody, and congratulations to PIM's team and also to Heslava team for competing so well. And we all learned a lot, and that is the main thing. So thank you so much.
Thank you very much, sir. Very rightly said. Ishaq Saab is a one-man show. Sir, Ishaq Saab, are you there?
Legend.
One of the most exciting matches that I had so far. Both the teams are playing so well that it's very difficult to sort of make a judgment. But I think Professor Aziz Rahman made a very good point. I actually missed the first half because of some technical reason, but the second half was very, very interesting and very entertaining. And everybody is full of faith for our moderator. It was nice to see Bilal Zikriya Khan and Professor Solit, who are seldom seen in these meetings.
If I may say something.
Yes, sir. Please. Sure, sir.
If there is any technical problem, I can maybe, if you allow me to, I can read out the questions.
Yes, sir. I think that will be fine.
Okay.
Let me, sir, just give me a second. I think the technical team is on it. They're asking for, you need 2 more minutes?
Okay, no, the 2 minutes, okay, no problem.
2 minutes, fine.
Yes, I think so, 2 minutes.
Hamza, I think this is one of the best matches that we had, and I think the questions were very good. I missed the first half, but the second part, it was very practical scenario. Hypertensive emergencies and urgencies are very inappropriately managed in our country. And I think the PIMS team has done a very good job by replying the right answers. I think both the teams should be given credit for fighting up to the last moment. And it's very occasional, very rare that we had to resort to these extra time and additional questions. So I think that speaks loud about their capabilities and their preparation. And I'm so glad that the standard is gradually coming up. And I think Wilson has played a very important role in this regard. And I must compliment Professor Aziz Rahman for making these questions. I think we should just concentrate on clinical questions, day-to-day practice, clinical practice, and try to correct their approach to the management of various conditions that we come across every day in our hospitals. But unfortunately, most of the time, they are inappropriately managed. So I think today's match is a testimony to the preparation that they have gone through. So I think the teams are taking things seriously, and this is very, very encouraging for us as teachers.
Thank you very much, sir. I think it was brilliant performance all around. The umpiring was outstanding. I think the umpire stepped in at the right time. And then the council members, what beautiful game we've had. Everyone chipping in and doing the bit. So I've just been told that the technical team is ready with the questions. So we are now back live in the game. Are the two teams ready?
Yes.
Okay, so can we have the first question on the screen and read the question, please. PIMS Victors, read the question, please.
For recurrent episodes of SVT, what is the most effective treatment? Number A, diltiazem, B, catheter ablation, C, amiodarone, D, verapamil, fifth is flecainide.
E is flecainide, and the timer starts now. 60 seconds.
B.
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 Option B.
B.
Option
B.
Beta.
Catheter.
Okay, B beta catheter ablation. They want me to lock B beta. Lock it, please. And yes, that's the right answer. I've just been told. Yes, yes, well done. You've hit that one for a 6. Unfortunately, we can't have on the screen the validation that we get from the technical side. But yes, it is the correct answer. Very well done. Another 6. Faisalabad Qalandars. Well done. Very well done. So you've put the other team, PIMS Victors, under pressure. But let's see what we have in store. Can we have the next question on the screen, please? Read it, please, Qalandars.
How will you classify him as per its anatomical classification? Option A, Stanford type A. Option B, Stanford type B. Option C, 𝐷𝐈𝐈𝐒 type 1. Option D, 𝐷𝐈𝐈𝐒 type 2. Option E, both B and D.
And your timer starts now. You can always revert to the image or the scenario if you want.
और जो 𝐷𝐈𝐈𝐒 वन है और जो 2 होता है उसमें तो 𝐷𝐈𝐈𝐒 type 2 और
This is the decider. Can they do it?
1 में असेंडिंग होता है 2 में एक्सटेंड पे आयोटी का 3 में डिसेंडिंग होता है तो फिर सिर्फ वो बनता है ना बी नहीं बनता
टाइप सी
नहीं बी
स्टैंडर्ड टाइप बी
ABC 3 में आता है
25 seconds remaining.
सी में आता है सी में कहाँ से आता है
सी में 𝐷𝐈𝐈𝐒 टाइप में डिसेंडिंग से होता है 2 में एक्सटेंड पे आयोटी का आता है
तो फिर ये बी होगा
बी होगा
15 seconds.
श्योर तो यही है बी
10 seconds. Which option?
ऑप्शन बी आप बी
B for? B for? Beta. Option B. Yes, that's the right answer. The umpire is already laughing. He knows it and we all know it. Again, it's a draw.
I knew it was going to be a draw.
My goodness. What are we at, sir? They are coming up with answers. What brilliant performance. And again, even after 12 questions, it's a draw. And I'm going to head back to our umpires.
I don't know, maybe now we can just ask if you have to, I think this has to be decisive, right? We can't keep it draw. We have
Yes.
this match has, maybe if we allow, maybe we can ask Professor Ishaq to ask just one question from each team. Or
Yes.
maybe I can ask just one question, state yes or no, and ask both teams. Whichever answer correctly, they will be regarded winner.
Very
And
right,
it
sir.
has
So,
to be-
Ishaq
A
Saab, are you
question
there?
has to be related to the scenario.
Okay, Ishaq Saab, are you there?
I'm here.
So-
You mean with respect to the scenario, you mean, or
Yeah.
Yes, sir.
general?
With the
First
respective
case
scenario.
was SVT or tachycardia. Just ask one question related to that from the first team, and the answer should be just one. You don't give choices, just one question.
Just one question.
Yes or no.
Okay. While doing a maneuver for vehicle maneuver for SVT episode in the ER, what is the precaution that you must take before doing the procedure?
Okay, so this is the question for allied Qalandars. Are you there, Qalandars?
Yes, yes.
Okay. Do you understand the question?
Yes, we understand.
You want to answer?
Yes.
Then answer.
What is
Go
the
ahead.
precaution?
We should auscultate the carotid first for carotid bruit before starting the vehicle maneuver.
Okay. What will be your answer, the other team?
Then the other team has to be asked the question.
So we'll have to ask from the other Vinay, sir. The aortic dissection one. I think that would be more fair. So you agree with the answer? You want to give them the score?
Yeah. Yeah, that thing the correct
Yeah,
answer.
that was right.
Yes, that's very right. Well done, Elite Qalandars. So you've got this one right. Well done. Well,
so give us the 3 types of aortic dissections.
No,
all right. So can we have PIMS Victors on the screen, please?
Please repeat the question.
Can you give me 3 types of aortic dissection?
The type A that involves ascending aorta, the type B which extend beyond the aortic arch, and type C that's involving the descending thoracic aorta.
Aziz Rahman sahab, kya kiya jaye?
Again, so
अब मेरा ख्याल है कोई non-medical question करना चाहिए.
Sir, I think we should give Aziz Saab, I think, one more go. Right, sir?
All right, I can ask one question. When you are dealing with a case of SVT, and what makes you suspect that this is not SVT, this is actually atrial fibrillation on clinical examination?
Yes, Elite Qalandars. Your answer, please.
Clinical examination portion.
Examination.
Clinical examination irregular pulse and variable intensity of first heart sound.
Irregular pulse, and there will be the variable intensity of a heart sound S1, first heart sound S1.
Okay, correct answer. Now the team B.
Very well done. Nicely answered. Well done. Brilliant. So, PIMS Victors, can we have them on the screen now?
If you have a young patient with dissection of aorta, what do you think is the predisposing factor?
Bicuspid aortic valve disease.
A young patient having dissection of aorta, what do you think is the predisposing cause, maybe the predisposing factor?
It could be the bicuspid aortic valve, which is certainly associated with genetic conditions.
Sir, your take on the answer.
I think I would consider aortic valve disease is there, but I think Marfan syndrome, in my opinion, is the correct answer.
Yes, sir. That should have been the correct answer, sir. I agree with you there.
Okay. Thank you for endorsing. So now we have 2 opinions to make
Sir,
it more
I did mention the genetic conditions which predispose a patient to dissection.
Genetic condition is a very, very broad category. I think you should have mentioned Marfan syndrome.
Marfan syndrome, and it's also a connective tissue disorder along with that. Yeah. So, I think Aziz Saab has a point. Professor Ishaq Saab, your thought?
I think she meant Marfan syndrome, but she just said genetic condition. So I don't think it can be taken as a positive answer.
Sir, so
genetic is a very wide subject, you see.
Yes.
It can be, yeah.
I think at least they should have mentioned connective tissue disorder or something like that.
Yeah.
Genetic
doesn't mean anything.
Genetic is a very, very insufficient answer.
So I think with this now we do know who the winner is. So I think very well played, PIMS Victors. I think you are victorious. In my view, in everyone's view, what a fantastic match we've had. And we all knew what you wanted to answer, but at times we want to say something and we just don't have the right words to go with that. But in the end, I think the toughest game we have witnessed, the most amazing match I've witnessed, and I've been doing it for quite some time.
Sorry for an interruption. I have a question, please.
Yes, sure. Please go ahead.
In explanation to the first scenario, Sir very rightly mentioned about the SVT characteristics, that it is very sudden in onset. He explained everything, and when we were doing the review questions like yours, we were doing it after it was drawn. The first question was from the other team was about SVT, and it excluded the option. It is gradual in onset or it is sudden in onset. So it was already explained by Sir, and he mentioned in an explanation that SVT is sudden in onset.
Yeah.
So
I also noted that, but that just happened. That was not planned. That just happened. And this is their good luck that I explained, because it was not actually planned that way.
सर फिर तो एक्सरे का लेबल भी लग गया ना गलती से।
उसका तो मैंने आपको क्रेडिट दे दिया ना, लेबल का तो क्वेश्चन नल एंड वाइट कर दिया ना।
सर उसका तो नहीं हुआ, वो तो हमें इक्वल कर दिया ना, दूसरी टीम को पॉइंट मिल गया था।
वो तो ठीक किया, वो तो ठीक किया। लेबल दूसरे के लगाने, लेबल तो मैंने निकाल गया तो लेबल लगा दिया। फिर क्या, फिर तो लेबल तो पढ़ना है, तो किसके लिए आपको टेक्स्ट आता तो फिर तो मकसद तो आपकी ये एबिलिटी चेक करनी थी कि आप इमेज रीड कर सकते हैं या नहीं कर सकते। I think match is now over.
Yes, I think, sir, in all fairness,
when the one goes to the next level.
Very well done. I think both the teams have to understand there's involvement of the whole council and they just want to be as fair as they can. We've had a wonderful game today. What a beautiful match it was, and very well done to both the teams. And I think we are already overshooting the time limit. Just a few words from the council members, and we have Professor Ishaq Saab. Sir, are you there? Just few final thoughts and then we'll pack up here.
I am always here and there at your service. I think it has been one of the most exciting and interesting matches so far. And I think both the teams are excellent in their preparation and in their knowledge. I think the loser is not a loser, but unfortunately one has to declare one as a winner. And Professor Aziz has really made it very important that umpire should be very alert and vigilant about any mistake, anything which is not fair to the other team. And I think he picked up the right objection. So I think both the teams need to be congratulated. The loser should not be called loser. It's a very high competition, and they went beyond, you see, their time score, extra time and extra questions. So, but one has to lose and one has to win. So I think it has been a great match, one of the most exciting matches. And up till the last moment, there was a sensation and excitement and interest in the match. So both the teams need my compliments, and they should not take it to the heart that they have lost it. They haven't lost it.
Thank you very much, sir. Thank you very much, sir. So congratulations truly to both the teams. We just don't have any losers today. And in the end, I think we have our other pattern-in-chief. It is Professor Javed Akram Saab. Sir, your thoughts, and we will all go running home with victories on both the sides.
Thank you, Hamza. I think previously we have been witnessing this league very closely, and it looked like matches. But now I think it's a World Championship, this match, because it was very well contested. The questions were very nicely framed. The venue was so good, and most of all, the commentator was superb, as always. So I think congratulations to both PIMS and to Allied. And inshallah, the standard is improving day by day by leaps and bounds. And Usman is doing a wonderful job at Wilson. So congratulations to everybody. And I'm so happy that we are now having more and more excitement, more tough matches, more competition. And most of all, we are all, whether me, Ishaq, or judges, everybody is learning from these things. So the idea is really to ultimately, I think we will have international teams coming in. I will make sure that my UK trainees or US trainees, they will also join in, and we will enlarge upon these, and we'll have an international audience as well as international teams. Thank you so much, Hamza.
Thank you very much, sir. Inshallah, definitely the league is growing by leaps and bounds, and it is the council members, our faculty, our umpires. What outstanding umpiring we've had today. What an amazing match we've had today. It's victory for both the teams in my view. I think in the whole council's view and in all the viewers' eyes, it is victory for PIMS victors and also Allied Qalandars. They both were superb, but we have to realize one thing at the end of the day. One team may take the cake that day, but it's the victory which is long term, which is the learning which is long term, and we are all learning as we grow. Every day we learn. It's a beautiful process, and we are all a part of this process. And right now, this process is known as Cardiometabolic Premier League. Hats off to Wilson Pharmaceutical, PHL, and Pakistan Society of Internal Medicine. What a match, what a league. And we're running out of time with this. It's my time to say goodbye to all of you. Allah Hafiz, till we meet next time.